To health issues now. Minister of Labour and Employment, Chris Ngige, has reversed his comment that Nigeria has surplus doctors and he was not worried about Nigerian doctors leaving the country. Mr. Ngige says he was quoted out of context, and what he meant was that these professionals have the right to seek training abroad to sharpen their skills and become specialists. He also insists that Nigeria has enough medical personnel to man non-specialist centers in rural areas. Several Nigerians had condemned the minister's earlier comment that Nigeria has more than enough doctors to cater for its health needs and can even export. Medical doctor Obinna Ebirim joins me now to discuss this. Many thanks for joining us at this time. You are a medical doctor practicing in Nigeria. Initially, when you heard the minister's comment, how did you feel? How did you react to it?
I was surprised, and especially coming from a medical doctor and a labor minister, because it's a known fact that in Nigeria, we are not able to meet the needs not available to meet that needs. The World Health Organization recommends 1 to 600 patients, and currently we have a doctor taking care of about 4,000 patients based on the available numbers. And I'm glad that he has corrected that comment, because I think what he meant is that the number of doctors graduating are adequate, but what is a problem is that we do not have the absorptive capacity to absorb these doctors to take care of our population. And I think some of the things that we need to do is to then begin to increase the infrastructure in terms of the number of hospitals, and also increase the funding, because it makes no sense having hospitals that are not adequately funded in terms of infrastructure, in terms of remuneration for the doctors and other health professionals, and also to increase remuneration. I think doctors in Nigeria are among some of the poorly paid around the world, and that is why you see most of them then go out for greener pastures. So it is wrong to say that we have adequate doctors to take care of our population.
Well, as it is now, yes, you also mentioned the minister has corrected a statement saying that he was quoted out of context. You recommended that, you know, there should be more hospitals provided and more infrastructure provided in these facilities. The cost of health care in Nigeria is considered high in some quarters, especially considering that people have to rely on the private health providers to get proper health care.
Yeah, so yes, that's true. So first of all is that the government needs to increase funding for health. Some time ago, we all brought heads of states to Abuja, and we agreed that we are going to allocate 15% to health. In Nigeria, where this decision was taken, we are yet to get to that point. We are still hovering between 4 to 6%, and we need to get 15%, because if you don't adequately fund the health sector, we will then not have enough money to pay the salaries of doctors and other health professionals, to equip those hospitals, and to provide adequate health facilities. So ideally, you need to have a primary health care facility close to the people, but we do not have these health facilities, and where they are not functional. So it's only when you have those functional facilities that you can then absorb a lot of doctors who are graduating from our tertiary institutions to then meet up that ratio, which is 1 to 600, and come out from the far ratio where we are right now, 1 to 4,000. That is not acceptable. We need to do something by increasing the absorptive capacity in terms of increasing funding to health and increasing the amount of infrastructure. And I think these are what we need to do. We need to show that the health of our people is important, and the way to do that is to increase the funding for health to get to the 15% Abuja Declaration for health.
At different times, the Nigerian Medical Association has gone on protests, calling on the government to heed their demand, make for better welfare for healthcare providers, health infrastructure, and all that. What is the response coming from the government to some of these requests?
So the response has not really been very positive, because doctors are not still earning what they ought to earn when you compare to salaries of doctors elsewhere, and that is what naturally takes them out. You hear a lot of doctors, Nigerian doctors in the US, in the UK, and all that. It's because of the remuneration. At home, it's not. Nobody wants to go to another country when he can earn as much in his country. Home is always sweeter. So I think the government needs to do more. And beyond increasing the remuneration of doctors, we also need to ensure that our people are covered health-wise. So the number of people covered by the National Health Insurance Scheme needs to increase. Right now, we are hovering between 1 to 5% of the population only covered by health insurance. That is not acceptable. The high level of out-of-pocket expenditure for health in Nigeria, it's unacceptable. We need to work more to cover most. One is the elderly needs to be provided with health insurance, and actually the entire population. There must be that health insurance package that fits various facets of the population, and if we do that, that's when we
medical Dr. Obinna Ebirim there speaking on the statement by the Minister of Labour and Employment, Chris Ngige, about doctors in Nigeria, and saying it was quoted out of context.